Yes, what do you want?
Hi, I'm John from ED. I would like to request a CT abdo for a patient with massive PR bleeding. He is stable for CT.
Is he currently bleeding?
Yes, he is bleeding quite a bit.
Okay, he's not stable enough to come to the scanner. Come back when he is stable.
Okay, he is now stabilized and bleeding minimally.
How much is he bleeding?
A few mils a minute.
That is too slow for us to pick up on CT. Come back when he is bleeding more.
Okay, he is bleeding at the right rate and is ready for his CT.
Get surgery to see him.
They have seen him and are requesting the CT.
If they want the CT, get them to come speak to me in person.
Hello, I am Michael from surgery. This guy really needs a CT. I have checked with the radiographers and they have a free slot for him now.
I am not convinced he needs a CT.
He needs a CT, so we know where he is bleeding from.
I am not convinced. How will this CT change your management plan?
We will operate depending on the results of the CT.
Okay. Does he have any kidney problems or diabetes?
No, he has no medical history and is very healthy otherwise.
What is his eGFR?
Over 90.
When was it done?
This morning.
Repeat it.
Excuse me?
Repeat it.
Okay, I have repeated it, and it is the same.
Does he have access?
He has a 16-gauge cannula in each arm. And I have checked they are working.
Has he had any previous contrast reaction?
No. And he has no allergies.
I want you to give him a test dose.
Sorry?
He needs a test dose. While he is in a resuscitation room with the anesthetist and an ICU bed ready. Also, have you discussed the risk of cancer from the CT scan with him?
I mentioned that there is a small risk, and he is happy with that.
I want you to obtain a signed consent form from him, and sign it yourself also. How senior are you?
I am a senior surgical registrar.
Has your consultant seen the patient?
No, but I am comfortable managing the patient, and will notify him after the CT.
I want you to call your consultant now, to get approval for the CT.
It's 3 a.m.
I don't care.
I have called my consultant, and he agrees with me.
Who is your consultant?
Professor Brown, the director of surgery.
Okay, let me see your request form. Here you have entered N.A. under pregnancy.
The patient is male.
Don't get smart with me. I have put him on the outpatient list and his scan will be done sometime. In 2013.
He needs that scan tonight.
Oh, would you look at the time? I have finished now. Talk to the next radiology registrar. He will be busy. In angio. Then ultrasound. But we'll be here within 6 hours, okay?